It's time to put your health in your own hands. Get ready to learn from today's top health and wellness innovators and thought leaders on Optimal Health Radio. Now, here's your host.
Hi, this is Tammy Patzer, and I'm excited to introduce today's guest, Dr. Robert A. Levine. Dr. Bob, welcome.
Hi, Tammy. How are you?
Great. I want to tell everyone a little bit more about you because Dr. Bob is a distinguished international speaker, brain researcher, and holistic health clinician. With his research-proven natural approaches, Dr. Levine has helped thousands of people reduce and often eliminate chronic pain and symptoms of stress without drugs. Now, this is such an important topic today because of the opioid crisis and the fact that so many people are living with high stress and, of course, chronic pain. So before we get started, tell me a little bit more about your background and how in the world did you develop this system for stress and pain-free living?
Well, thanks for that question, Tammy. It's actually a long road that I traveled. I got my Ph.D. in George Washington University in 1982 doing brain research, and then I did fellowships and worked overseas in Switzerland for a while. It was really a fun time of life, and I did a lot of groundbreaking brain research in the area of neurology and psychiatry. It wasn't until about 1994 that I developed a really bad problem with my back pain and hip pain. And there was, unfortunately, at that time, there was nothing in conventional medicine that could help me resolve the issue. I was told that I was diagnosed with severe degenerative osteoarthritis in both hip joints, and I was told to wait as long as possible to get hip replacement so I could outlive the hip joints. And I thought, wow, this is a future vision that I'm not interested in having. I want to be full of life and active, and back to the days when I was doing sports, like I played football in college on scholarship, and I skied all over the world, and I was really active as an athlete, and I was unable to perform as an athlete during that time. So I started exploring alternative therapies, and it took me about, and nothing really was working. It was always helping a little bit. It's interesting when you embark on trying new modalities, new therapies, or new approaches. People need to know that they want to look for this will work. They want to have the attitude or the future vision, as we call it, this will work. And if this doesn't work, the next thing will work. If that doesn't work, the next thing will work. And it has to go on like that until somebody unravels their situation. Otherwise, most people with chronic pain, for instance, have the future, or even if they're addicted to opioids, they have the future vision of, I don't think it's going to work for me. I don't think I can really get out of this. I think I'm going to be stuck here, and I just got to struggle with this and manage this, right? My future vision at the time was, I'm going to get this thing better somehow, and I don't know how I'm going to do it. So I explored all of these alternative therapies, and fortunately, at the end of the line, about 6 months later, and many thousands of dollars, and doing 2 to 3 hours a week in different therapies, which at that time, based on my conventional medical background, I called voodoo therapy, because I was working in a laboratory and doing basic and clinical research, and in that line of work, you have to have the data. If you don't have the data, then you don't have proof. So that's why I jokingly called it voodoo therapy. But I really went for it because it's like, nothing in conventional care has helped so far. I've got to try whatever I can try. If I have to go to India and sit in a cave for a year and being quiet, I'll do it. Whatever I got to do to get my life back, because chronic pain is just really challenging for people. So I finally, after taking more than a dozen different kinds of therapies, I finally unlocked the problem. My back pain and hip pain went away without drugs, and then I was free to be active again and doing sports. And that was in 1995. And so then I said to myself, wow, the world is missing something here. I just went from limping around in chronic pain and gaining weight and being miserable to being pain-free and back to being active again and being happy. It was easy. It's easy to be happy when you're not in chronic pain. It's really challenging to be happy when you're in chronic pain. And I know because I experienced that. So I really have a lot of empathy for people who are in chronic pain. So I started, what I did then was I said, okay, I need to find out, how did I heal? What happened? How did these therapies help me? So I started getting training in a lot of different modalities, a lot of different approaches in the alternative arena. And when I say alternative, it just means that it's not covered by health insurance. That's pretty much how we define it these days, right? And what was interesting is in all that training, my primary goal was to answer the question, how do people heal? Like, how did I heal? What happened, right? So fortunately, I believe I've answered that question very well, which has allowed me to be the effective and successful person in terms of helping people get out of chronic pain and relieve stress and all the symptoms of stress-related conditions, because we know that stress is an underlying factor in nearly every ill health condition, right? So it's really important to deal with stress on many different levels. So once I got out of pain, I started getting training, and then I said, okay, I need to train myself in running clinical trials. And fortunately, at that time, I worked at a large healthcare system, Henry Ford Health System in Detroit, Michigan, where I directed the Center for Integrative Wellness there, which I created as a result of knowing that we needed to have that in the health system. So they blocked that out for me. I had a team of people, a director position, a team of people, and we started running clinical trials. And so it was very interesting to run these clinical studies. And then I was able to prove that the approaches that I had learned about and had perfected and was using were actually effective in helping people eliminate chronic pain and reduce chronic pain. And we did this in a large group format. We started with one-on-one care, and I realized we could migrate that to large group approaches. So we did large group seminars where I basically taught people from the stage what they needed to know and what they needed to do to get themselves out of pain with the right guidance that we provided with our different approaches. And we got some remarkable results, which you saw, which are, several thousand people. We had nearly 40% of all chronic pain conditions eliminated in a multi-session group program where we didn't put our hands on anybody. We just gave them the resources and guided them in what they needed to do on their own, at home, during the day, at work, little things that they could do, very simple yet effective things that they could do to get themselves out of chronic pain. Because everybody has to heal themselves in a way with the right guidance, whether it's a pharmaceutical drug, whether it's a practitioner doing one-on-one care, whether it's a book they're reading, whatever's going on for them, they have to heal themselves. And we know that. So that's why we provide them the tools. And that's why we're so effective. And we also showed in our clinical studies that the results held up to 16 months. We checked 8 months and 16 months. So that's great when you can take somebody, have them be pain-free without drugs, and then it lasts for up to 16 months or longer. We just didn't test any more time than that. So those are phenomenal results. And, so that's the basis, the fundamental basis of the programs that we offer now. And that, as you know, we're offering programs up at AdventHealth in Celebration at the hospital there. Starting May the 16th, we have an hour-and-a-half introductory type seminar for stress and pain-free living, where we're going to provide people a roadmap for how they can get themselves out of pain and to know that it can be much easier and much more simple than they think it can be. So that's what's happening, coming up soon. And I just wanted to pause there to let you see if there's something you want to know more about.
Well, you said it. Well, the whole thing that you said was very interesting, but you said one thing that I thought was very telling. You said you discovered how to unlock the issue you were having, and then you were able to get rid of that chronic pain condition because you were diagnosed with something that was literally a life sentence of pain and chronic pain, but you did not accept that. So that was one thing that I noticed that you said. And then you said that you created this program where you can actually help people to learn how to heal themselves. And that is very important because one of the things I found, especially in the Western culture, is that we often think that we need to hand our health over to a doctor and then they prescribe a pill or something, and that is our answer. So that's interesting. Now, the program that's at Advent Health Wellness Center in Celebration coming up, it's stress and pain-free living, live your life to the fullest. And you're actually going to spend time explaining to people about how in the world do you become drug-free and pain-free. So what is this? Can you give me a taste of what this roadmap is that you're going to be teaching people?
Yeah, it's based upon the fundamental principle that people from a very early age develop these automatic patterns, automatic habits and patterns, if you will. And those automatic habits and patterns, in a sense, run their life. And so if you're in an automatic pattern, and the automatic pattern contains a lot of different components, like for instance, how we think, how we communicate. There's automatic patterns related to that. People know that because they have the same kind of conversations over and over again and wonder why the conversations don't work the way they want them to. They're not that effective, right? So we actually teach effective communication in our program because most stress, people don't realize this, almost all stress, first of all, stress is generated from within, which is how we can be effective. Because if stress came from the outside world, all the triggers come from the outside world, but the stress doesn't come from the outside world. If the triggers came from the outside world and the stress came from the outside world, we'd have to change the outside world. So people would have to make all kinds of changes, get new geography, get new people in their lives, get new jobs, everything would have to change. Fortunately, though, when people realize that they're generating their stress, we can teach them how to interrupt those automatic stress reactions. So everything we do is about interrupting automatic patterns. Hence, we call ourselves automatic pattern interruption experts. And our whole technology, if you will, or all the approaches are based on that. So there's movement involved in automatic patterning, the way people sit and stand and all these different contortions that people get into. And here's a tip for people. One of the most fundamental issues let's say mistakes that people make is that when they're in pain, let's say they're in pain here, they move away from the pain. Like I'm in pain here, but if I move here, I don't have to be in pain anymore. So they end up being like this, trying to move away from the pain. And then this is a dysfunctional pattern. The pain comes again, they have to move further. And you may have seen people walking down the street all contorted, right? Well, because they spend so much time moving away from the pain rather than dealing with it, let's say, right? And finding a way to interrupt the pain, that they end up in this chronic pain pattern, and it's really debilitating, and it's structurally a big problem for them. So we deal with all kinds of, so we do, communication, we do, how we interrupt thoughts that we don't want, and how we interrupt a style of communication that hasn't been working. How do we replace that with styles of communication and thinking that work for us? Moving in three-dimensional space, there's issues that most everybody has with that. A great example is walking. I would say more than 90% of the people walking around the planet are walking inappropriately and in a way that ultimately will lead them to have problems in the future, and especially ending up on a walker, later in life. I mean, I can bear that out if you go look at an independent living facility or an assisted living facility, it's 90% plus on walkers. It's rare you see somebody just walking around without some kind of walking assisting device. So, the average person takes between 3,000, if you don't walk that much, to 10,000 steps if you do what's recommended, and even more if some people walk more than that. Every day, 10,000 steps a day, right? So if you're walking inappropriately, that's a lot of movements, right? The average person takes between 30,000 and 50,000 repetitive movements every day, between walking, sitting and standing, bending and reaching, repetitive motions that they do all the time. That's a lot of repetitive motion. So, and that explains to me why it's hard for people to go to see a practitioner of any kind, whether it's a physical therapist or whether it's an acupuncturist, a chiropractor, a primary care physician. It's hard to go to see somebody on a regular basis, let's say once or twice a week even, which I was doing back then when I had my problems, and get out of pain. Because, you start to get some relief in the sessions, like, wow, this is really good, feels good. Yeah, thank you. Then you walk out and you go back to your automatic patterns of life, 30 to 50,000 repetitive movements a day that are reinforcing the pain. And so until we alter those repetitive automatic patterns, it's going to be really hard to get people out of pain. Since we focus on that in everything we do, that's going to help people be effective at getting themselves out of pain. And one more thing we teach, well, there's a lot more, but one more thing I want to mention is that we teach a technique that we developed called effective muscle release. So, if you've ever seen somebody who stands around, their shoulders are like this, right? The shoulders are up in the air, close to their ears, and they don't even know that they're there. That's because it's an automatic pattern. And those muscles, the trapezius muscles at the top of the shoulder, are holding the person in a dysfunctional state and burning energy and getting fatigued, and those muscles actually never turn off. Even in bed, they're up, they're on to a certain extent, they're contracting, burning energy. So, in fact, that could explain why people wake up in the morning after a nice 8-9 hours of sleep and they're still fatigued and they're still stiff and they still don't move very fluidly, right? So we teach this technique called effective muscle release. It's really, really simple. It's so easy to do. People can do them in bed. They can do them in a wheelchair. They can do them sitting in a chair. We teach them, and we teach these techniques in the chairs. So people are sitting theater style. So we can put, 100, 200, 500 people, it doesn't matter, in a room, and we can teach them exactly what they need to do in terms of releasing muscles that are in excess contraction and allowing the body posture to achieve a balanced, pain-free state, right? So that's just one of the other many different approaches that we use in our programs. And I'll be talking about all of those, and we'll be doing some demonstrations too, that people will engage in some of this. So, because we want people to leave with a sense that, wow, I created a change here in this simple hour and a half session. What could I do if I had more of this? And we also are going to offer people the opportunity to register for a multi-session program that we're going to do up at AdventHealth Celebration. And that'll be a great thing, and it's going to be very cost effective for people. It's going to be on the order of what they pay for their copays anyway, and they're going to be able to come to these sessions. We'll teach them. We'll give them all the resource materials they need in terms of we use guided meditation. That's another thing we use. Guided meditation is very important because it allows people to harness the power of their whole mind in a relaxed way and start to interrupt these automatic habits and patterns, which are driven by the mind. So unless you work with the mind, it's really, I don't know, I think it's almost next to impossible to, I hate to ever use the word impossible, but it's really hard to unlock automatic patterns that are generated by the mind unless you work with the mind. You can work with the muscle, that's causing discomfort, but the mind is a critical component of that muscle that's in pain. So that's why we work on the mind, body, spirit connection. We do the whole deal. And it's really important to work with the person as a whole.
I think that's interesting because you started out earlier and you said because of your background, you thought that all of this was woo. And
woo.
it makes me wonder because you talked about the mind, body, spirit connection, and you talked about future visioning of seeing that you do have a solution. You talked about that muscle release and about guided meditation. Of all of the things that you teach, you made those different connections. Which of all of these things is the most effective in combating that the pain and drug situation? People, they all want this quick fix.
Yeah.
Is this actually a quicker fix than taking a pill? It almost sounds like that once you learn these techniques, that it's a quicker fix than a drug. And why is it so hard to eliminate drugs out of our world?
Yeah. Well, I mean, I'm not saying, first of all, that's a lot of questions there. Really great questions. First of all, I want to point out that you're thinking a little bit like a conventional medical practitioner who says, well, of all these things that you do, which one is the one? which is saying, like, and there is no one. There is no one, actually. See, when I went from treatment 1 in the alternative realm to treatment 2 to treatment 3 to 4 to 5 to 6, back to 2 to 3, back to 7 and back to 5, and all mixing these things all up, but mostly doing things sequentially, like treatment 1. Okay, that didn't really do it. Treatment 2, that didn't really do it. I call that sequential multimodal. That means you're doing things in sequence, 1, 2, 3, 4, and you're using different modes of therapy, right? So sequential, 1, 2, 3, 4, and then modal, sequential, multimodal, many modes of therapy, right? And that was not very effective. And I also proved to myself in the clinical studies I ran that sequential multimodal was also not very effective, even under clinical trial conditions, right? So to answer your question, Tammy, it's not one. If we did just one, they probably wouldn't work. I always say you can't take somebody with anxiety and send them to a chiropractor. They're not going to be that effective. You give 100 people with anxiety and send them to a chiropractor. The chiropractor might do really well with 10 of them, let's say, or 15. That's kind of, in my mind, it's a generous number because it's the chiropractic profession is not necessarily geared toward unlocking an automatic pattern of anxiety. So also, I don't think you can send somebody in chronic pain, back pain, for instance, or hip pain, to a psychologist and have them be effective with 100 people, getting them out of chronic pain. So that just says that a single mode of therapy under the wrong conditions is not really going to be effective. So when we do our programs, we have people coming in with migraine headaches, cervicogenic headaches. Those are different classifications of headaches. Back pain from no obvious reason, back pain from trauma, neck pain, carpal tunnel. I mean, there's such a broad cross-section, and every individual has a unique history, right? So our programs are always designed to be under the umbrella of, we're going to teach you about automatic patterns so that you can identify yours. And then when you identify yours, we're going to teach you how to interrupt any automatic pattern. And then once you interrupt something that's automatic, you're free from it, right? It's automatic, can't be helped, can't be stopped. And then all of a sudden, bam, you interrupt it and you're free of it. Then you're free to start making some changes. And then that's when we start putting in, okay, what would be a great thing to replace what you were doing before with? What can we advise you on? What can we show you? What can we demonstrate to you proper walking, which we do. And I don't know very many people anywhere that teach proper walking the way we do. And it's really important because I always say if I could de-stress somebody with relaxation work, guided meditation, and I could teach them how to walk properly, we could probably eliminate, a huge percentage of chronic pain conditions. But the bottom line is we don't know what's underneath every person's, what's underneath that automatic pattern that's truly driving the situation. There are people who are in chronic pain that have had early abuses in life of sorts, either some kind of trauma. There are others that haven't. So there's a big difference. So without dealing with the mind, body, spirit connection, in other words, the whole, without dealing with that, we're not going to be as effective. So that's why we deal with all those components. And we tell people, look, you may not think that you need a mind component for your chronic pain, but actually I can guarantee them that they do, because the mind component is huge in terms of chronic pain. And the stress is a mind-related stress generation from within us is mind generated. So we have to deal with the mind. I always say if you don't de-stress somebody while you're trying to get them out of chronic pain, it's going to be challenging to get them out of chronic pain. So that's why we always go for unlocking the stress component, interrupting the automatic stress reactions, right? So I'm not sure if I answer. And by the way, my PhD is in pharmacology, so I know a lot about drugs. I studied drugs for decades, right? And I know one thing for sure, and when I give lectures on this to the medical community and physicians, I always say there's never been a drug invented that addresses the underlying source of an illness. They're all of Band-Aids of sorts, and some are really great Band-Aids, and others are not very great Band-Aids, right? So, but to address the underlying source of an illness, the drug will not get the job done unless the drug is taken, and then it facilitates or helps the person interrupt some automatic pattern that they don't even know they have, and then they can get themselves out of pain or whatever the condition is, whether it's anxiety or depression or fatigue or sleep disturbance, right? But for sleep and anxiety, I mean, we don't advertise this about our programs because our focus is on chronic pain. However, chronic pain people don't sleep very well, right? They have automatic patterns around that involve sleep disturbance and stress. I mean, people in chronic pain have a lot of stress, no matter what. They generate a lot of stress. And I know because I experienced that. I was pretty grumpy, I would say, when I was in chronic pain at times. It was really challenging. And I'm highly trained in being happy no matter what the circumstances are, being relaxed, being peaceful, being calm, being confident, being comfortable, being accepting of what's going on, right? Being forgiving of others. And yet when I was stuck in chronic pain, it was really challenging for me to be that person that I always want to be, right? So I'd shift into this grumpy thing, and then I'd come back to being the person I wanted to be. I think I covered most of your question. I'm not sure.
Well, again, this is such a deep subject, and it's such an important subject because, again, if you can treat chronic pain without drugs, think about that. That's a breakthrough type of thing. And I think that you've really outlined a lot of things that most people don't think about. I don't know that most of us are walking around saying, oh, I'm in chronic pain. I know I'm stressed, but how do I interrupt this pattern? And I was thinking about when you were talking about teaching people how to walk, I'm thinking, well, yeah, think about it. How do humans learn how to walk? They're babies, they crawl, and then they get up and they start walking. Nobody ever taught us how to walk properly or how to normally sit in a chair properly. And the fact that we're sitting in front of computers, or many people, they have their phone and they're like that, and so contorted. And I know that for me, sitting down, I'm always compressed right here. So it's really interesting to me, just the very idea that we're talking about, that there are things that you can teach people about. Okay, here's how to walk properly. Most of us, I don't think we ever think about that. So this stress and pain-free living event at AdventHealth Wellness Center in Celebration is coming up May 16th, 19th, and 20th. And you have several opportunities for people to do this 1.5-hour program. So
right, we have three sessions on Thursday, right? Okay. Morning, midday, and late afternoon. 3 sessions on Sunday, late morning, mid afternoon, and early and later in the afternoon. And then on Monday, the same thing. It's morning, midday, late afternoon. We can hold 80 people per session, so there's plenty of room for people. We're charging $20 for pre-registration. Everybody who pre-registers gets a free gift that they're going to love. And We do that to encourage people to register online, save some money. It's more expensive at the door, not much. It's $30 at the door. But we want to encourage people to just make that commitment. It's like, hey, I'm going to go to that seminar, Stress and Pain for Living. I'm going to listen to what Dr. Levine has to say. I'm going to see what I can integrate in my life. I'm going to see if I want to do another program that they're going to offer at AdventHealth. Multi-session group program. They'll get all the materials they need. And it's going to be really quite cost effective for people. We normally charge, anywhere from $600 to $900 for a multi-session program. This is going to be way less than half a day. It's going to be great.
Wow. Well, that's really cool because, again, if you can work with someone to eliminate that stress, and I think you're absolutely right. We are we create our stress. And so many people often, when they're stressed, they think, oh, I'll change my job. I'll move to a new location. I'll get rid of my spouse or whatever it is that you think is stressing you. But it's really our reactions to stress that
Right.
that is creating these issues. But how cool would it be if you could learn how to eliminate that, the headaches or the lower back pain or the muscle pains. It's interesting that you brought up the idea that people are tense in their shoulders, because I was watching a TV commercial and this man was on the show, and I noticed that his neck and his shoulders seemed to be really short. And you just answered that question. I said, I bet you he's under a lot of stress because
Yeah.
it's very tight. His shoulders, neck, there didn't appear to be much
Yeah.
space. And I was thinking, oh, that probably is the reason why, because he's always so tense. And I have woken up where I've slept all night long, but yet I wake up and I'm all stiff.
Yeah.
From being all tense. So wow, if you can teach people how to relieve some of that automatic tension, that would be really cool. And again, this I've been reading through all of the different automatic patterns that we have, and the automatic communication, I think, is another issue that many of us could really learn from. So, stress and pain-free living, live your life to the fullest, and it's at AdventHealth Wellness Center. Before I let you go, because we could probably talk about all of these different things all day long, is there one thing that you can think of that is really vital for people to do to unlock their automatic responses to daily life?
It's like asking me if there's one modality that we use, one approach that we use that can help somebody. But I'll give you a couple of tips in a minute. I just want to say how people can get in touch with the information about the stress and pain-free living programs at AdventHealth Celebration. They can go to our website, which is stressandpainfreeliving.com, which is the title of the seminar. Stressandpainfreeliving.com/ if they seminar flyer, that'll give them the flyer with all the information that'll pop up on the screen. So it's stressandpainfreeliving.com/ seminar flyer, right? If they want to find out more about me, they can go to our website and go and type in stressandpainfreeliving.com / Dr. Bob Levine, Dr. Bob Levine, DrBobLevine. And that'll bring up a page which has all my background information. And then they can also, if they want to register for the seminar, if they see all that and they like it, and they want to register for one of the 9 different opportunities to get the 1.5 hour seminar over the 5 days, actually, 3 of the 5 days, Thursday, Sunday, Monday, they can go to stressandpainfreeliving.com / seminar. And that'll take them right to the registration page, and they can go ahead and sign up. So that's how they get involved with that. So tips to interrupt the automatic pattern. All right, just knowing that here's a tip. When the results that people are getting are not the results they want, they can count on the fact that it's the result of an automatic pattern that they have yet to distinguish. Does that make sense?
Yes.
So if people were interrupting their automatic patterns all the time by themselves, they would always have the results they want, right? That's one thing. They can say to themselves, "Oh, I'm not getting the result that I want. Therefore, I must be subject to an automatic pattern that I'm not aware of right now." And so then we do something called future visioning. So what are the future vision results that somebody wants? In other words, what are the results that somebody really wants to produce in their future, right? And when somebody is not getting the results they want, things are not working the way they want, they can shift their focus to, okay, what are the results that I really want in my future vision? Okay, they can focus on that. That's going to help. And they can start to breathe, take a breath. And I want to be pain-free. I want to be pain-free soon. The next thing I do is going to help me be pain-free. And if not the next thing, the thing after that. And if not the thing after that, the thing after that. And I will become pain-free, and it will happen soon. I just want to be guided in the right way. And so then that puts people on an exploration for getting out of chronic pain and relieving stress. So, but the breath is really important. We do a lot with breath. We do a lot with teacher visioning. We deal with the communication. We deal with effective muscle release to release the body structure. We deal with physical activities of daily living, the walking, sitting and standing, bending and reaching, which has people locking in their pain without them knowing it, and much more. But that's just so that's a those are the tips I would say is that and be careful moving away from pain. You want to always be on the edge of pain, exploring the discomfort and saying, okay, brain, my mind is focused on this pain. And my mind, which is the overall umbrella, is telling the brain, see if you can figure out how to fix this. See if you can figure out how to release the problem in there. See if you can figure out how to bring the appropriate energy and blood flow and healing to this area. So the only way you can do that, you keep moving away from the pain. It's like resisting the pain. And resistance causes persistence. That's another thing we teach in our program. So if somebody's resisting something, it will persist. So we want to be accepting of that pain that we have. Like, not that we agree. We're just going to be okay that it's there for now. And we're going to have the intention or the future vision that the pain will go away fast. Is that helpful?
Yes, because again, what you just said, if you're resisting something, it persists. And when you learn how to accept or acknowledge something and start figuring out, hey, gee, if I do this, it kind of releases. I just noticed that when I moved my head that it was useful. So everyone, you can sign up for this and get more information at stressandpainfreeliving.com and go there. And of course,
fly seminar flyer. That would be
seminar flyer. And you can find out more about Dr. Bob Levine by doing stressandpainfreeliving.com/Dr. Bob Levine. And you can get all kinds of information. And the cool thing is if you register or pre-register online, you save some money and you also get a free gift. And that would be really cool. Everybody likes free gifts. Again, Dr. Bob, thank you so much for sharing this. And I'm sure that you'll have other group seminars in the future. But this is a great opportunity that people can take advantage of right now. And there's a lot of different availabilities to do that. I guess that you have actually 9 different opportunities on May 16th, May 19th, and May 20th during different times of the day in celebration at AdventHealth Wellness Center. So there's a lot of opportunities to participate with this program. So before I let you go, again, it's stressandpainfreeliving.com/seminar flyer.
Well, that's the best place to start, seminar flyer. Or if they want to just register, they just say /seminar, and they'll take them right to the registration page. And we set it up for Thursday, Sunday, Monday because we wanted to give people all the opportunity to step in for an hour and a half and really get a new view, a new perspective on their chronic pain and on stress that they may be experiencing in their lives. And so we wanted to make it easy and we wanted to make it really inexpensive. So that's why we set it up this way. And I'm really excited to be working with AdventHealth, who've been fantastic in the whole experience of bringing this our approaches forward to the community up there. So I'm hoping to see all the people who are watching this and listening to this. I hope that see them at the events.
Oh, great. Well, Dr. Bob, thank you so much. And everyone, I also have the information in the show notes. So you're literally just a click away from all this great information. So Dr. Bob, thank you so much. I really appreciate your time today.
And thanks for having me, Tammy. It's really been fantastic and fun to talk to you.
Great. Thank you. Everybody, remember, it is stressandpainfreeliving.com/seminar. Go pre-register, get a free gift, have a great time. Meanwhile, this is Tammy Patzer. Go make it a beautiful day.
You've been listening to today's top health and wellness innovators and thought leaders on Optimal Health Radio. To get more solid health and wellness information, visit OptimalHealthRadio.com.